Good evening, St. Lucia. Welcome to HealthWise, a production of the St. Lucia Medical and Dental Association in collaboration with HTS Radio 100. I am your presenter, Dr.Merle Clarke, thanking you as always for joining us and inviting you to stay with us for the next hour as we continue to discuss matters pertinent to your health, including but certainly not limited to COVID-19. COVID-19 really does occupy a lot of our headspace and a lot of our time, but as has been said before, sometimes it is important that we don't think about it so much. Understand what we have to do and understand that it is a fight, but for the sake of our well-being and our mental health, that it's not what you should focus on all the time. Yes, we, the physicians, the public health officials, it has to be on our agenda every single day, most minutes of the day. But for you, the general public, you do your part, you stay home, you wash your hands. If you're feeling unwell, you contact your physician or one of the respiratory centers. But for the most part, do things that you enjoy. Just take off the stress. The things that you're used to doing, you can't necessarily do them, but there are other ways to cope, which don't necessarily include alcohol, but there are ways to cope during this period of COVID-19. So yesterday, St. Lucia joined the rest of the world in observing World Day for Midwives. And a reminder again that this year, 2020, had been designated or has been designated by the World Health Organization as the year of the nurse and the midwife. And a simple definition of a midwife, I'll look up what I have here, is a person, this says typically a woman, trained to assist women in childbirth. And I mean, that is such a simplified version of who or what a midwife is. So essentially, a midwife is a nurse generally with extra training, so a specialized nurse in assisting in childbirth and the care of the pregnant woman, maternal and child health essentially. But they really do so much more than that. They confidence, they really, most of them, they run the primary care clinics, the health centers. The midwives, our midwives do go above and beyond, and they do so much more. So St. Lucia, despite the fact that COVID really has interrupted our lives in ways not before seen in our lifetime, in the way we practice, as we've been showing you over the past few weeks, there are things that remain the same, that in the profession, in medicine, in nursing, midwifery, that we are human beings and we are treating with human beings, we're dealing with human beings, and we have to do it in a way that people feel satisfied at the end of the day, and our midwives certainly do that. And I'm sure, well, when we were at VH, for the most part, you'd have heard many complaints about many parts of VH. But perhaps the area where you heard the fewest complaints about would be maternity, and that is, it's telling. It speaks of the competence. Not that our other nurses are incompetent, they are. And there are complaints, of course, that are sometimes not necessarily legitimate or fair, in a sense, not to insinuate, of course, that everything is done perfectly. And we understand that communication needs to improve, not only in hospitals, but really around St. Lucia, the public service generally. We need to improve how we communicate with the public that we serve. But the maternity ward, you really don't hear much in terms of complaints coming out of there. There's a sense of unity among the patients themselves, everybody with their little baby, and the nurses, they're just such consummate professionals, the midwives there. St. Lucia's infant mortality rate, I think we're about 12 per 1,000 babies born. Last count, I stand to be corrected, but that's where we've been over the past few years. Of course, in more industrialized countries, those numbers are way lower, and we have to work continuously always to reduce that infant mortality rate. So countries like Cuba, of course, where there's some provinces that register 0 infant deaths, and the death of an infant is registered normally as a child under 1 year of age dying. Very low in Cuba, comparable if not better than quite a few of the more industrialized countries, but we are still at 12, which is fairly high. Not the worst, but still fairly high, and we have to do better. But even that, in a resource-limited country like ours, is again a testament to the hard work, the dedication of our midwives. There's more we can do, but they really do excellent work. And solutions, just to speak now, to our pregnant women or women who have childbearing age or women who are trying to get pregnant. It is important, speaking of that infant mortality rate, everything always comes back. It is important that if you're trying to get pregnant, or if you're not necessarily trying, but you're sexually active and the possibility is there, that you take care of yourself. You always try to maintain a healthy weight. Blood pressures, blood sugars should be in check. Ensure that you see your physician once a year. Don't drink excess amounts of alcohol. Do not smoke. So all those things could impact a potential pregnancy and of course contribute to higher infant mortality rates. Of course, actually seeing your nurse or your midwife or your physician during your pregnancy is exceedingly important, because as it is in 2020, there are still women who get to the hospital in labor and have never had any medical attention prior to the time of delivery, and that is really unfortunate, because there's some basic things that have to be done, all for the well-being of both the mother and the child. So let's take note of that. So we've prepared a short tribute. Again, me and my last minute nurse, I asked them for those pictures this morning. So we don't have all our midwives here, but we've prepared a short video tribute just so, St. Lucia, you meet some of our midwives, of course, the families, the women who've delivered over the years here in St. Lucia. You would know some of those very familiar faces. Those who access healthcare at our primary care facilities, you would be familiar with some of those wonderful faces that you're going to see in the video tribute. So, Kalila.
Okay, coming right back to you.
Yes. I can wear my glasses. So that's it, Lucia. So congratulations to all our midwives on the observance of World Day of the Midwife. You deserve so much more, and we certainly will celebrate. Once COVID is well and truly under control, we will find a way to show our appreciation for you. Many different things to discuss as it pertains to COVID and otherwise. And before I get to that, we celebrated the midwives as such today, but today, the 6th of May, it starts the week, Nurses Week. So generally, the 6th to the 12th of May, is recognized as Nurses Week, and generally there are a series of activities that take place. Everything, of course, this year will be more low-key than usual, but just so St. Lucia, I mean, your nurses, and earlier this year, and certainly more so in other places, you see stories, very unfortunate stories of nurses being, in a sense, victimized and ostracized because people fear that they may be spreading COVID outside of hospitals. Thankfully, St. Lucians, we really are beautiful people. That does not happen so much, but it doesn't mean that it does not happen. There are the looks, and there are the turning down. There is the turning down of the nose on the part of some people. But I mean, our nurses, they press on because that's who they are. You have to be strong to do nursing, and they do manifest that every single day. So there was an argument on, it was a paper, I don't think I brought it, in terms of UE thinking of starting, what I'm thinking is going to happen on the campuses, the islands with campuses. So that would be Jamaica, Barbados, Trinidad, and the Bahamas. A trial of the drugs which have shown some promise in COVID, in treating COVID. And right now, COVID, this was first spoken about late December in China, but of course now it's been postulated that is very likely started even before, that there might have been cases even outside of China before December 2019. But the official word is that COVID was first discovered late 2019, and since then there's been talk of different drugs that may work. Everything of sorts about COVID is somewhat anecdotal. The information is changing almost on a daily basis. It is an extremely fluid situation, so we can't say there is anything definitive that we know about COVID. What you do know of SARS-CoV-2, it is a coronavirus because, of course, of the shape of the virus with the little peaks on the surface, similar to what that virus which caused SARS, and that's a virus which caused MERS. So there are certain characteristics of those that we would like, or that this particular virus has and can be attributed to it. But certainly this has proven to be a lot more infectious. The others, they were contained long before this one has been. This one continues to wreak havoc on countries around the world, economies around the world, literally has the world on standstill. So trials have to be done. And I think there is an innate mistrust in pharmaceutical companies, in anybody who's doing research or trials of any drug, and particularly among us here perhaps in the Caribbean, where we don't have a culture so much of research, which we should. But the story came out that the trial will be starting with some of the drugs which have shown promise with COVID, because thankfully here we seem to have done well and we have this under control for the most part. But as we've seen around the world, many people have died. Over 70,000 in the US alone. I'm not sure what the total is. We will see it on our dashboard, which shows yesterday's figures, how many people have died worldwide of COVID-19. So there is no question. So yes, our dashboard is up here. Let me look. Total number of COVID-19 deaths, I think that's globally 239,604. Thank you. So when a virus has killed over 200,000 people in a 4-month period, let me see, December, January, February, March, April, May, in a 5-month period, you have to do everything, throw everything at it, and try and find a drug that's going to be effective against it. When you're talking about a virus that those patients who end up in ICU and on a ventilator, a very high percentage, in some studies over 80% of them die anyway, you have to try to find a cure. Will you find it? Not necessarily, but you absolutely have to try. So going back to the trial, the plan is to look at treating COVID patients with some of the drugs which have been spoken about. So I believe it was hydroxychloroquine. Unfortunately, I don't have the article. It was the Cuban, the interferon alpha B, remdesivir, I believe, and I can't remember the fourth one. When we go to break, perhaps I'll find that article to see those drugs. But there was quite a bit of backlash, and as I said, it stemmed from the lack of trust, because as far as people are concerned, why is this being done here, and why are you all trying to do this in the Caribbean? The reality is those drugs are being used generally. Those drugs are already in use for different things, be it for malaria, be it for HIV, be it for lupus, rheumatoid arthritis. Those drugs are being used. What the trials are about is saying what the effect will be in patients with COVID-19. Because in some places, what has been shown is that if you use, I think hydroxychloroquine was the fourth one, if you use some of those drugs in patients who have moderate symptoms, perhaps mild to moderate symptoms, their hospital stay or the course of the disease is shorter. And the reality is, you have to be able to find something. For quite a few viral illnesses do not have cures, and that's what we have to understand. So if you have a pneumonia which is caused by a bacteria, you use antibiotics. Antibiotics are effective against bacteria. Antibiotics are not effective against viruses generally. So with viral infections, you normally treat what you call supportive care. So what you give is supportive care. So the person has fever, you may give paracetamol or something else to bring down the fever, something for pain, so they feel more comfortable, and generally the virus runs its course. Just think of the common cold, for example. Unless you get a superimposed bacterial infection for a common cold, it's not treated with medication as such. So the reality is there are very few antiviral medications in the world compared to, say, antibacterial medications. So one of the diseases with perhaps the most antivirals is HIV. And there are quite a few antivirals because they all work differently, in a different way to try and impede that virus. So what happens is a patient normally would have a combination of those drugs. So all of this to say that viruses do tend to mutate, and treating viruses or viral infections has historically proven to be difficult. So a virus which is virulent, if that can be used, a virus which is virulent can cause a lot of death. Look what happened with the HIV epidemic in the 80s and early 90s in particular, before they started coming out with effective treatments. Now let's just say that had never happened. If no research had been done in terms of a drug that would be effective against HIV, in as much as it's not cured, but HIV in 2020 is considered a chronic illness, just like so many other chronic illnesses, because patient survival, if we look at Magic Johnson, for example, he was diagnosed in 1991. Let's calculate, 2001, 2011, 2021 will be 30 years, so 29 years this year he would have been living with HIV, whereas when the HIV epidemic just started, we're looking at life expectancy well under 10 years. So the reality is research works. Drugs work in as much as we may not like it, but we have to find something that's going to be effective against COVID-19. And it's not a question solution. We're not saying don't question. You absolutely have to question everything. But the reality is, in medicine, research is a constant thing. When you go to conferences, when we go to conferences, that is what we do. What is new in terms of research? What are the new papers around? Something, which is why medicine changes so much. So whereas this year something may be that way, and we may say, no, let's not use this for a particular thing. Somebody does a big research paper or a big trial, and 5 years down the line, that changes and we go back to what we were using before because it proves to be more effective. What may be effective in Caucasians may not be as effective in black people, or may not be as effective in people of Indian descent. So you don't know these things unless you do research and unless you do trials. And that really is what those trials are about. Of course, with the race for a vaccine, a lot more mistrust even for that. And that's fair, because I questioned as well, why is Bill Gates so involved? And there's a lot of questions, legitimate questions. And I mean, we deserve to have answers to our questions. So that one is a bit more understandable when it comes to a vaccine, with particularly the anti-vaxxers movement that has really taken the world in a sense by storm. They do have a very loud voice. But when it comes to trials and doing drug research and drug trials in a particular thing, that is something that is done every single day, everywhere in the world. So those trials that they're talking about doing with, from a UE perspective, those have been done in all these other countries around the world to see how patients respond. Is it indeed true that you have lower rates of death when you use certain drugs? Is it true that patients stay out of hospital more, patients don't become critically ill? Because again, as I said, we're looking at a virus or an infection that if you end up in ICU and you end up on the ventilator, your odds of death are still very high. And particularly when you combine that with the high rates of kidney injury that those patients are getting, then the odds of somebody dying, young, old, everybody, does increase quite exponentially. So just to keep that in mind when we look at trials and different papers and that sort of thing, that not everything is sinister and not everybody is working in the interest of big pharma, that we as physicians, our role really is to protect our general public. And if ever there are questions about a certain thing, they are asked. Thousands of physicians in the world certainly do ask questions. Another small paper, and again research, shows that vitamin D, that lower levels of vitamin D seem to be, patients with lower levels seem to be more predisposed to getting not just COVID, but other respiratory infections. And again, larger studies have to be done. But an interesting point, and I remember discussing it with Dr. Amanda King and Dr. Cleopatra Altino, is the number of St. Lucian patients that we have with, or just regular St. Lucian citizens, that when you measure their vitamin D levels, they're quite low. Because in the past, what we all thought and what we learned was, in the Caribbean, there's sunshine and we play outside and our vitamin D levels are very good. And it's turning out not to quite be so. So it will be interesting, what we were thinking of actually, doing some sort of study, research to find out why. Why are vitamin D levels so low? Now, we do have a hint in that the melanin in our skin does inhibit, in a sense, it's protective in that from the UV rays to a certain extent, but that also does block vitamin D. And the whole vitamin D process is a complex one, because even after that, vitamin D from the sun has to be activated in the liver and then activated in the kidneys before it can actually be of any use to you of sorts. So that is why patients with liver disease and kidney disease do tend to have low levels of vitamin D and all inherent problems that come with that, the bone disease and all of that. So it is all linked. Long and short of it is that our immune systems need to be at their best. If we're going to defeat COVID, not only as a country necessarily, but as individuals, we need to have healthy immune systems. And as I've said before, there really is no magic to having an immune system, a healthy immune system. There is no one-day booster or one-day cleanse that's going to do it. It's a continuous process. It's a process of ensuring that you're exercising, you're getting adequate rest, you're not stressing yourself out unnecessarily, because that does directly affect your immune system. Ensure that you're eating right, your vitamins, your minerals, including vitamin D. Ensure that you have adequate amounts, have a balanced diet essentially. All those components are important in terms of us having a healthy immune system, which is going to allow us to combat not only the coronavirus and COVID-19, but any other virus, parasite, bacteria, and the like. So the other big debate was contact tracing. And I've been promising to have our epidemiologist, Dr. Michelle Fassois, on. In fact, I'm still hoping today that she would be able to send us something in terms of the process of contact tracing. But it is a complex thing because, of course, what happened in on the East Coast, I believe you saw images last night of several ambulances taking away members of, I don't know if it was one family or different families. And the process of contact tracing essentially, in a nutshell, in essence, is if somebody is diagnosed with COVID-19, or even if you're suspicious for it and you don't have a result yet, that your contacts do have to trace. So if I'm positive, then my family, they're my contacts, they're immediate contacts. If, for example, we were going to work regularly and being all about the place, it does make it infinitely more difficult, because then you have to find every possible person that this patient came into contact with. The hope is that, of course, we are complying and staying home. So if somebody is positive, the number of contacts is smaller, because if you've been out into the supermarket and everywhere, it does make it that much more difficult to get everybody. And the reality is, let's just say, and we had shown it in the past, how quickly one person could potentially infect between 2 and 3 persons. And if of those 3 people, then potentially could infect between 2 and 3 persons. So the number could increase very quickly. Over a short period of time, a large number of people could become infected. So you start seeing the importance of those physical distancing measures and staying home if you absolutely don't have to go out and the like. But just to read a small bit about contact tracing, and as I said, we promise that we'll have our epidemiologist send us something in very soon in terms of how it applies to St. Lucia, what are the difficulties faced, because some countries speak of apps for contact tracing, and of course they're very efficient. I don't pretend to know exactly how they work, but they are working in some of the countries. The privacy issues, of course, become, it always gets a little iffy when it comes to people's privacy, but again, we are fighting a war and we need everything in our arsenal. So what is contact tracing? In the coronavirus era, a host of epidemiological terms have entered common public use. There's a now newly politicized flatten the curve. And as states and local governments seek a way out of lockdowns that have brought the economies to a near standstill, contact tracing has made its way into everyday conversation as well. But what exactly is contact tracing, and how can it help society battle the COVID-19 epidemic? Here are the basics of the time-tested public health strategy and the hopes for its use in the coronavirus pandemic. And just so we understand, contact tracing is not unique or new. It's not unique to coronavirus. It's been around. For example, a patient with a sexually transmitted infection, your contacts normally would have to be found. Again, the privacy issues, but when it becomes a public health matter, contact tracing in particular is important. So what is contact tracing? Contact tracing is a little like detective work. Trained staff interview people who have been diagnosed with a contagious disease to figure out who they may have recently been in contact with. Then they go tell those people that may have been exposed, sometimes encouraging them to quarantine themselves to prevent spreading the disease any further. Think of it as part of public health work and part investigation. Part public health work, part investigation. The technique is a cornerstone of preventative medicine, says Dr. Laura Brer, Medical Director of Occupational Health Services at the Mayo Clinic. Contact tracing is having a moment of glory right now with COVID because of the crucial importance of identifying those individuals who have been exposed quickly and isolating or quarantining them. Contact tracing was used during the 2014 Ebola virus outbreak, as well as in the SARS outbreak in 2003. It's used also to combat sexually transmitted infections and other communicable diseases like tuberculosis. And as COVID-19 has gone global, countries like South Korea, New Zealand have aggressively used contact tracing in an attempt to control the outbreaks. How does contact tracing work? Once someone has been confirmed to be infected with a virus, such as through a positive COVID-19 test, contact tracers try to track down others who have had recent prolonged exposure to that person when they may have been infectious. Typically, the exposure means being within 6 feet of the person for more than 10 minutes. So that normally would be the criteria. Now, I mean, nothing in life is perfect. One-on-one is not always two, but generally within 6 feet, so less than 6 feet away from the person. So you see how important it is, or why it's important to stay 6 feet away, and for more than 10 minutes, says Dr. Bray. Through a healthcare setting such as a hospital, the bar is lowered to 5 minutes. And again, doctors, nurses, people who work in hospital, you understand why you've seen death sometimes around them, because again, you may very well be exposed, especially if not using protective equipment, to a lot more virus. The load may be a lot more than the average person, because you are dealing a lot of the time, or most of the time, with people who are unwell, not necessarily just with COVID, but so your exposure is a lot higher. Healthcare workers then make an effort to reach out to every one of those contacts, tell them that they may have been exposed, and giving them instructions what to do next. They may include telling them about possible symptoms or directing them to self-isolation. What are the limitations of contact tracing? For one, contact tracing is a laborious process. Interviewing infectious patients and reaching out to the dozens of contacts takes time. For that reason, contact tracing works best when there are lower levels of infection in a community, says Dr. Frank Esper, a pediatric infectious disease specialist. When you get to a point where there are lots of people who are sick with a particular infectious disease, it quickly overwhelms the health department's response to be able to contact trace all those individuals. With a virus like COVID-19 or SARS-CoV-2, which spreads quickly, things can get complicated very quickly. Contact tracers might end up trying to find those who sat near an infected individual on a plane or bus, for instance, even if the sick person never met them. That's a radically different task from contact tracing with a sexually transmitted infection like HIV, which tends to involve a much shorter, more well-defined list of contacts for investigators, hopefully. Healthcare workers may also have trouble getting in touch with contacts if phone records aren't kept up to date, or if an infected person is already too sick to help identify their recent contacts. Contact tracing is also isn't much help when states and localities have already issued lockdown orders and when most people are self-isolating. You write that out, which is what we're doing. And of course, this is an article coming out of the US. So as I said, their context, in a sense, would be different from ours. So the underground game, the getting the community involved sometimes so you get intelligence information is also very important. But it is a difficult task, and long and short, we all have to do our part. And some people view it sometimes as, you know what, squealing on your neighbors and that sort of thing. But you know, for the protection and survival of all of us, somebody has to squeal, and we have to tell it. And of course, patients have to be honest in terms of where they've been, if they remember, and who they might have been in contact with. So logically, your family generally would be your immediate contacts, and those people normally would have to be quarantined if they are well, that is asymptomatic, or isolated if they already are manifesting symptoms. Another worrying trend, of course, which the chief medical officer spoke of, is the fact that the men don't seem to be, the percentage of women to men seeking help at the respiratory clinics is, well, women way higher than men. And is it that men are just not seeking care, that you're staying home even if you have respiratory symptoms? That is worrisome if indeed that is happening. And I will tell you that the clinical care lines, the numbers that have been posted, and perhaps we could find those to show you again, I have one of those phones, and in the beginning you would get quite a few calls for assistance. What should I do if I have this? And I haven't received a call in an entire week. I feel very bad actually, but the question is, are we all feeling well, or is it that people don't want to call because they fear that they may be guided to a respiratory clinic and you don't want to be admitted and all of that? But St. Lucia, the reality is sometimes we do have to make the sacrifice. If you need to be admitted for a few days, then that's the sacrifice you may need to make for your family and for your country as a whole. Of course, with isolation, the quicker you get a test result, then the better for everybody. The less work for the physicians and nurses in a sense. And as I had explained last week, what is happening is you having transfers between the two hospitals and of course the Rodney Bay Medical Center right now, because if a patient has symptoms, if the patient has shortness of breath combined with fever, whereas in a pre-COVID era it might have been viewed as one thing, right now it's COVID until proven otherwise. So the bar is very low for admission to the Victoria Hospital, the conditions of which are not ideal, and I think we all know that. But once your test results are back, if it's positive, of course you stay there, but if the test results are negative, but you still need to be admitted, then you would be transferred to the Owen King EU Hospital. If your test results are negative and you're well enough to go home, then you go home. So it is frustrating for families. There have been complaints about information, not being able to access information, and our medical director will be speaking to that, and she has spoken of that this week. But the reality is, the doctors who work there to give you information, they have to be readily available, because there is a phone, and again the number is listed. If you need to contact your families, you obviously can't go in to see your relatives as we used to as St. Lucians to doing at visiting hours. You go see your relatives. For obvious reasons, you cannot do that, but the doctors will have to give you the information. The problem is though, if the doctor is all gowned up in PPE with their dirty gloves and everything else, they cannot speak to you at the time. So say when rounds are happening at 10 in the morning, 11 in the morning, and you call, the doctor may not readily be available to give you any information about your relative, and that is becoming frustrating for relatives. And we understand that you're worried about your relatives, but we ask, and improvements are being made in that regard, as in terms of who mans that phone. Should there be somebody manning that particular phone 24 hours? But again, you look at the issue of privacy. Do we want anybody else but your doctor and perhaps your nurse to know your medical information? No, you do not. So all those things do have to be taken into context. Another complaint that we saw, why are patients, in particular dialysis patients, being asked to stay outside of the hospital like AA? The reality is we're living in a new world, and as we said, physical distancing, social distancing, it is important. Our dialysis patients are very vulnerable patients. They're susceptible not only to COVID but to other things. So the dialysis unit inside, and as Nurse Danielle spoke of last week, we've made changes. Our chairs are far apart enough that we don't have any major issues there. So between the patient and the other patient, there is enough space. We have a 6-foot distance at least. But our waiting room is relatively small. So we've advised our patients, of course, come for your shift. Don't come before, because there are times it happens. Patients come before the shift if they live far away, for example, and that's the time my ride is available. I'll come up, say, in the morning, despite the fact that my shift is in the afternoon. Or some people may come, in case somebody did not come, I could occupy that chair and get an earlier shift. So of course, we're discouraging that right now. The issue is though, if you allow business as usual and patients are all sitting in our small waiting area, conversing and communicating, because they are a family and we are a family, then it doesn't augur well for our COVID response. So what we have been doing is having the patients, if you come early and the nurses aren't ready for you yet, or if there's an emergency, or if we have to do an acute patient from the ward, the patients are asked, if you have a vehicle, you stay outside in your vehicle and we call you when we're ready. The nurses are excellent at calling our patients, because the patients call themselves if there's an issue. But sit outside the unit, of course 6 feet apart, or you may very well stay outside if you want to. But it's not just a question of us asking the dialysis patients to stay outside. And the patients have been very, very cooperative, because we all understand why we're doing what we have to do. It's not, these aren't decisions just made on a whim that I just want everybody to stay outside nowadays. And this goes not only for dialysis patients, but for other clinic patients. So clinics have resumed, but of course they're more limited. There's a certain number of patients per day. We as physicians have been asked to select the patients who we think need to be seen more quickly. And particularly in the case of our chronic patients, we know them. In my case, for example, a patient with stage 5 kidney disease, I would need to see that patient sooner than the patient with stage 3 kidney disease, whose blood sugar and blood pressure is fairly well controlled. So there are many changes which have had to be made. We are going to have to adapt to a new normal. Some people don't like that word, but the reality is, if we're going to successfully defeat COVID and it's going to be with us for a while, then we have to adhere to those changes. So in our, I think our dashboard now, if we could just make reference to it, it hasn't been updated for today. It's generally updated daily, but let's just see what our take another look at what our numbers are to date in terms of globally and here in St. Lucia, in terms of the number of patients who have been tested, the number who've been diagnosed with COVID-19, the number in isolation as we explained last week, and the number in quarantine. So at the top, of course, and this is available on the Government of St. Lucia pages, the Ministry, the Bureau of Health Education pages, on the St. Lucia Medical and Dental Association pages, on social media, and on the general website. So if we see at the top there, over 3 million people diagnosed with COVID-19 thus far, 239,604 deaths globally. Currently in St. Lucia, thus far, there have been 18 patients diagnosed. And sorry, the question is asked over and over. If we have 15 patients who've recovered, patients who've been repatriated, why are we still saying 18? We have to say 18. It's a cumulative number because bottom line in St. Lucia, that is the number of patients who have been diagnosed with COVID-19. So as of yesterday, the total was 18. I see here the number of COVID-19 patients who are in isolation in the respiratory clinic, isolation 2, and recovered patients 15. So no deaths in St. Lucia from COVID, thankfully, and 575 tests done. So in the next image, we'll see a comparison between the member states of the Eastern Caribbean Currency Union. And if you could see that well, so in terms of the most cases, we're looking at Antigua, followed by Grenada, and St. Lucia in third place there with 18. So 25 in Antigua, Grenada 21, St. Lucia 18, St. Vincent 17, the Commonwealth of Dominica 16. You made that very short, thank you. And Anguilla at the bottom with 3. And if you see the other side of the table, just more information comparing where we are as a small group, the OECS countries, and how we're doing. So for the most part, the OECS is doing fairly well. Issues of testing, most people still have those nagging issues that you don't have consistent in-country testing. Some people have no in-country testing at all. And here, we have had issues, but this weekend there was the exchange made, and even that caused a little bit of controversy. And I think, again, that was perhaps due in part to lack of communication on this end in St. Lucia, because in the Cayman Islands, it had been spoken of widely that there were talks with St. Lucia in terms of test kits being sent over and St. Lucia providing those pipettes. But that wasn't communicated very clearly here. So, of course, when the Cayman people made their case that the Cayman Airways had landed and had, gotten testing supplies from St. Lucia, it seemed that St. Lucia was providing testing supplies. Now, to me, of course, it just seemed ludicrous, the idea that we would have been able to provide testing kits. But us, of course, we were aware of what the exchange was. So later on in the program, we will just have our lab director, Dr. Felicia, explain what exactly the exchange entailed, and we will have him next week just give us an update as to where we are with testing, in-country testing, because again, we are not where we need to be. We certainly need to be doing a lot more widespread testing. The talk of the rapid test, which is the antibody test, what is the role for that? So we need all of that explained to you, St. Lucia, so we understand as a nation where we are moving forward. What strategy for testing are we going to use? Which asymptomatic patients are we testing, and so forth, and so on and so forth? Because in many countries, in Dominica, for example, St. Vincent, a large number of the patients have been reported to be asymptomatic. Again, I always question, is the patient truly asymptomatic? Was the interview directed enough? Because COVID could present as a respiratory illness. You're seeing in some cases abdominal pain, in some cases diarrhea, and so many different things. It's new and things are emerging each and every day. So we do have to take that into account. But even here, the patients, the symptoms have been very, very mild indeed. So those things do have to be taken into account. So St. Lucia has spoken enough now, so we'll go to our segment celebrating excellence. And this evening, along with our nurses and midwives, we celebrate Dr. Jamie Mader. Dr. Jamie Mader is a 29-year-old medical practitioner currently employed at the Owen King AU Hospital and currently doing a 2-week stint, a rotation at the Respiratory Hospital, which is Victoria Hospital. As far back as she can remember, medicine had been her passion. Therefore, she worked as hard as she could to secure an opportunity to obtain a full medical scholarship in Cuba. She obtained her bachelor's in medicine in 2017, and she's been actively practicing at the Victoria Hospital OKU since then. Her ultimate goal is to specialize in internal medicine and hopefully practice as an internist in the region. And Jamie Mader, and this huge crush on her uncle, but you know, too much information there. Jamie Mader was one of those little girls when I used to go to church every day, every Sunday and every Saturday, because I had to do 3 years of confirmation class. I wonder if children still do 3 years of confirmation class. But she used to be this little girl running around in the church. I'm like, that cannot, when she finished medicine, that cannot be that little girl. But yes, that is that little girl who's 29 years old now. And I mean, really an excellent physician, a hard worker. She was here on HealthWise earlier this year. And certainly we will be seeing more of her. So people like Dr. Giffard, Dr. Mader, Dr. Haynes, Dr. Chico, I mean, with them, you know, the future of medicine in St. Lucia is bright. So St. Lucia, again, with that, we invite you to, well, meet again our lovely Dr. Jamie Mader. So that St. Lucia was our Dr. Jamie Mader, house officer in the Department of Oncology, Internal Medicine, and currently in COVID. Well, everybody is somewhat, to a large extent or not, part of the respiratory hospital. So with that, St. Lucia, we will take a quick break, and when we come back, in keeping with our format over the past few weeks, because everything has had to change in a sense, with our physical distancing being necessary, we will allow our healthcare providers, our medical director, hopefully, and some others to just speak to you in terms of how their practice has changed, what is expected of you, St. Lucia, as we move forward with COVID, as we continue this fight against COVID-19, and we will win. I think, mark my words, we will win and we will rebuild this country, but we absolutely have to do it together. Back after the break. Welcome back, St. Lucia. And as I said, we will let our other colleagues speak this evening to you about the experience with COVID-19 and the changes that have had to be made in their departments. And then I'll just do the St. Lucia again. We do hope that you have been enlightened, that there's some more understanding of the processes and I mean some of the difficulties that we are having. We do hope that we will all cooperate in that regard. Certainly, if you have a complaint, you let it be known. There are ways to let your complaints be aired, and we are always willing and waiting to listen and to see how we could improve your experience, because we know things are far from perfect. They really aren't anywhere in the world. But we will get through this together, St. Lucia. So we invite you to watch a rebroadcast of this episode on Sunday afternoon. We thank you for staying up with us, and we invite you to join us next week, Wednesday, for another episode of HealthWise. Bye-bye.